Hi everyone, Dr. Cary Yurkiw here for True North Practice Management. Welcome to today's webinar on care plans. No matter what kind of health professional you are, having a plan for the patient and communicating the plan to the patient is very important. And it's important for a number of different reasons. One, for the success of the outcome with the patient. You want to involve the patient. You want to make sure you get consent from the patient. The more the patient participates in the healing process, the better the outcome is going to be, and the more you transfer responsibility longer term to the patient, the better the outcome will be, as well as it reflects well on your practice and the type of business you're running. When you're being forthcoming, you're being forthright with the patient, and ultimately the patient's going to appreciate that communication. It's part of the experience of going to your clinic, and they're going to tell others. You're going to get referrals from that, and it's going to improve the way your practice is being managed. So at True North, this is something that we teach our clients, and we want to make sure our clients are providing the best quality care they can to patients and running the best healthcare business with our help. This is part of a webinar series that we have coming up. So please join us for future webinars. You just have to click on the link in the under our Facebook page called Events, and you can see the upcoming events and sign up for them. We will have some advanced webinars coming up, as well as some mastermind groups that we're working on in 2021, and of course our one-on-one coaching. So we'll talk about that a little bit later. My name is Dr. Cary Yurkiw, and I've been practicing for over 25 years now. The first 3 years of my career I did locums, which was great because I was able to see a number of clinics, over 50 clinics in a short period of time. And that allows me to see different practice setups, different ways of managing patients. And it was a great experience. It gave me a lot of confidence. I became a better practitioner because of it. And then I've owned my own clinics. I've built clinics from scratch. I've designed clinics, I've done construction and building and owning property. So I've done all of that, as well as I've seen over 10,000 patients in my career. So at this point, I consider myself an expert at what I do. I continue to improve. I take webinars on a regular basis, seminars to update my skills, but I also feel that it's important for me to give back to other practitioners that are just starting out in practice. I have different types of clients at True North. So some of the clients are doctors, some are therapists, and so they are experts at what they do. It's how they apply what they do that we help our clients with. So it's how they're applying it, why they're applying what they do, how they're running their practice and their business, how they're balancing their lifestyle. So there's a whole bunch of other things that we're not experts on when we graduate from professional college that really we need to learn about. And rather than learning by trial and error and making a lot of mistakes, having a mentor or a coach like us here at True North can really help support you, help to keep you focused, and ultimately lead to a more successful outcome than if you were doing it on your own. So today we're going to talk about care plans. And first of all, when someone comes into your clinic, you want to collect good information from them. So the first impression that your clinic makes on the patient is important. The way the phones are getting answered, your website, the new patient form. So all of that has to be consistent with the type of care that you provide in the clinic and the information you need in order to be able to assess the person properly and give them the proper recommendation. This includes the history taking, so make sure you're thorough with your history, your examination, and the testing you're doing. Make sure that you're doing the best examination and testing for the patient to have the most accurate diagnosis. And of course, when you come up with a diagnosis, it's important to have a differential diagnosis or a plan B or even a plan C of what it could be, and if your treatment is not progressing as well as you hope, what plan B would be. So that's very important. Communication is important too. Once you have a diagnosis and you have a plan of action for the patient, communicating that to the patient is very important. So you want to communicate your results, and you can do that in person, or you could use something like telehealth to do that. I find telehealth very effective in communicating results and making recommendations to patients. So you can do that verbally at an appointment. You can do it in writing, have a care plan written down, and you can use telehealth. And I like to use all three. For the care plan, you want to be really clear with what you're going to do for the patient and why. You also want to let the patient know what the expectations are from your care going forward, what the risks are, what the reward of going through with the care is, and how they can participate in the process. You want to answer their questions, because this leads to a much better doctor-patient relationship, as well as allows the patient to participate in the healing process. You want to let them know how many visits it'll take for you to help them, and you don't have to be exact, but an approximate number of visits in a time frame, and when you're going to do a re-examination. And I find a lot of practitioners don't really lay out these steps for the patient and then tell them when the next re-examination is going to be. That's important, because that's a checkpoint to let the patient know that they're completely healed, they're partially healed, and then it's a good checkpoint for you to compare your findings, your examination findings, to when you started with the patient, as well as update your recommendations for the patient. And those could involve different types of things the patient can do for themselves, and how they can take better care of themselves going forward. So the re-exam, you want to do similar tests. You want to make a new recommendation for the patient. I like to do that again in verbally and writing, and you might want to use telehealth for that. Let the patient know what their responsibilities are, and then any lifestyle changes they need to make at that point. I have a template we use in the clinic. The template allows us to, for me or my staff, to enter in my recommendation. So depending on what I found out, the variables will change, but that template allows us to have the most complete information for the patient, and for us to be able to change the variables. A lot of the fees are calculated based on the variables we're changing. So you want it as comprehensive of a template as possible. I like to keep this on Google Sheets, and then I will download that completed the complete information into a PDF format. So I like to use the Google Sheets for my template, and then change the information based on the patient's recommendation, and then download that as a PDF. So be as detailed as possible in your care plan. You can use the written form, the PDF, as a talking points when you're going over the recommendation. Some visual aids is good too. So you might want to have some diagrams if you're using telehealth, or even something in the clinic where you can show the patient a model of what you will be doing for them. Use objective measures and reassess the person using the same objective measures when you do re-examinations. This allows you to change the plan and to change the recommendation. And if you need to, have a plan B if plan A is not working to the best of its ability. So make sure you're using subjective measures. I like to use surveys. I use Google Forms to send out survey to the patient. So basically asking them similar questions to when they first came in. And then I like to also do my objective tests. So I have the subjective, the objective, and then I can let the patient know how they're progressing, and if we're on track, if we're behind, or if we're ahead of schedule. If you're interested in our service here at True North, the way our service works is we offer an initial consultation where we send our clients or prospective clients a survey. So you're able to fill out a few questions on a form. It's really simple. It allows us to have talking points with you. So we ask questions like why you became a health professional in the first place, what your mission and vision is for yourself, for your practice, for your community, and what goals you have set going forward. Then we'll schedule a first session, and usually we send out a link to our clients, and you can schedule your first coaching session. And that's a 15-minute session. It's complimentary. And based on that session, if you would like to move forward and we believe we can help you, we're going to schedule a follow-up. And the follow-up sessions are usually 30 to 45 minutes, depending on the client. We provide email and text support between calls. So we expect this whole process to be about 60 minutes or 1 hour of our time for each call, including the support. And then we schedule 13 sessions in advance. And that can be done in a 13-week period or a 26-week period if we're talking to you every 2 weeks. We find that gives us enough time to see progress, and yet the progress is made in a shorter period of time, in 3 months or 6 months. It's not dragging out too long where you're wondering if the coaching is working. The cost for our sessions are $275 US, and that's billed per session on a weekly or every 2 weeks basis. Or sometimes if the client wants to prepay, we will give them a discount depending on how many sessions they're booking and over what period of time. We'll give them a discount for prepaying. Then we'll reassess after those 13 sessions. So we want to see how much progress you've made. We'll do the same questions again, and we might add a few others into it to find out how you've progressed with the coaching, and then reassess the goals going forward. And then we'll book another 13-week period, or 13-session period, I should say. Will it be worth it? And this is one of the questions that our patients have is, in a year, if I did 52 sessions at $275, that would be $14,300. So would that be worth it? And it's amazing that for the clients that we have, that when they reassess at the end of the year how they've progressed with coaching, was it worth the time? And did they grow as an individual? And will that carry forward for the rest of their career? And those answers are yeses. And the patient, the client is very happy with our coaching and wants to continue going forward. The cost, because of the efficiencies that are created in the clinic, the better patient care, the referrals, the growth in the clinic, how we've advised you on managing the growth, ultimately that financial growth should cover the cost of the coaching in a year. So you should see those results. Or if you're not covering the costs, then maybe the program needs to be adjusted. It's not for you, or we may need to cut back on the number of sessions. Or maybe there's some other factors. Maybe other things came up that affected the progress, or sometimes the client's just not motivated to make changes and to grow, and so we have to take a break from the coaching. So really, if the coaching is working for the client, all these variables are being met, and the client is very happy with the coaching that we're providing for them. We started a separate company last year. We launched it in November, called Healthcare Classified. So if you have any needs in your clinic, whether it's finding an associate, selling your practice, looking for or selling equipment, or job opportunities, you can go to healthcareclassified.com and you can post an ad for 30 days for free right now. I encourage you to do that because it's a great value to your clinic. And then for the advanced webinars, we have advanced webinars planned coming up this year, topics that people are really interested in. So topics like cash flow, topics like hiring staff, topics like how to sign a lease or how to purchase a property. These are all things that certainly I've been through, and I want to make sure that I advise my clients properly on these topics. And you can join us for an advanced webinar where we get much more into depth about how we can help you. These advanced webinars, we do charge a fee for those webinars. They're usually around $90 US, and you will see them in our under our events tab on Facebook, or you can go to True North Practice Management on Eventbrite, and you'll see those paid webinars there as well. We do plan on having mastermind groups this year. As our client base increases, we want to get like-minded people together and share stories of how their practice is progressing. And we plan on doing that monthly. So if you're interested, please send us a message and let us know you're interested in the mastermind group. We expect to have that up and running this year. So it is a work in progress, but it is something that we plan on getting going as the year progresses. You can follow us on Facebook Live, where we have these webinars, usually on Saturdays, and sometimes we even have special guests. So you can join us for different guests, whether it's specific fields or specific areas of expertise. You'll see an upcoming event list under our Facebook events tab. Usually we're booking out about 6 weeks or 6 webinars in advance. And for our social media handles, we're on Instagram and Twitter at True North PM, on Facebook at True North Practice Management. We are on YouTube and at True North Practice Management, where you'll see a number of recordings like this one on our YouTube page. Please subscribe to that page. Our podcast is called Health Professional Success. It's on Apple, and it's on Spotify, and it's also on Google. And our website, truenorthpracticemanagement.com. So I want to thank you for joining us today for our care plan webinar. I hope you learned something and how you can better communicate with the patient, how you can get better results with patients in the clinic, and then of course, how you can get better results to manage your practice and your business. I hope to see you at the next webinar, and please feel free to click on the link below, where we will have an opportunity for you to book the first session, that 15-minute free consultation. This offer is good for a short period of time, and the spaces are limited, so please feel free to click on that, and we look forward to talking to you soon.